Thank you very much. So next we have Jean-Francois Leroux, who's going to be talking about reflecting pain priorities in federal politics. So I guess this is the man you want to touch base with in terms of resources. He's the manager of the chronic pain policy team at Health Canada. In his role, he oversees the coordination of the federal response to the Canadian Pain Task Force recommendations. Prior to joining the team in October of 2021, Jean-Francois held many policy positions within the federal government, including in the Department of Finance Canada, Health Canada, and the Canadian Institutes of Health Research. Thank you for joining us.
Thank you. And as I tell everyone, I'm not so good with money, so well, I just want to thank Hans and all the team for the invitation to speak today. And you'll see, like, my presentation is going to switch gear a little bit, where someone said that that person was not medically knowledgeable. Well, it's probably me, at least medical. But I'm going to talk to you a little bit about policies and how we've been able at the federal level to kind of like build some momentum on the pain front. So just to start, just a little bit of a recap about what has been done over the past 20 years or so, and kind of like this is a little bit of the trajectory that you can see there with some of the key organizations, networks that has been established over the years. Starting with QPRN, the Canadian Arthritis Patients Alliance, ACUDC in 2004, and then Pain BC in 2008, and then in 2011 there was a call for actions around the development of a national pain strategy that was put together. TPS in 2014, and then in 2016 the Chronic Pain Network was established. Even though like there was still a little bit of like a lack of momentum, a lack of understanding about how important this issue was. And then in 2017, 2016, something called the overdose crisis hit. And that's really shed some lights around the importance of this. And I think some of the previous talks actually talked a little bit about this. We've seen there was a lot of efforts at the beginning of the crisis to actually promote appropriate prescribing practices. But unfortunately, these actions led to significant unintended consequences. Health professionals started to report fear of regular scrutiny, inadequate training, insufficient time. People were rapidly tapered or cut off of their opioid medications, or increased stigma for people living with pain. So huge issues. In 2018, we actually held a national an opioid symposium. Before that symposium, we actually had an opportunity to have a conversation and bring pain experts, people living with pain, together in a room to meet with the Minister of Health at the time, Jeanette Petitpas-Taylor. And Dr. Teresa Tam was also in that room. And I think this was really a turning point to kind of like get some momentum going. And at the end of the symposium, there were 3 commitments made by the Federal Minister of Health, one of which was to explore the creation of a National Pain Task Force, recognizing the significant impacts. Task Force was formally established in March of 2019, and it involved like 24 experts, people with lived experience from different organizations, different fields, reflecting that together they kind of like were able to provide some advice about what to do with this issue. It had a 3-year mandate that was divided into 3 distinct phases. The first one was to review the evidence about how chronic pain was being addressed. The second phase was to consult broad national consultations and review the evidence to identify best practices. Obviously, during that second phase, as you can see from the date October 2020, we were in the midst of the COVID pandemic, so everything became virtual. But that didn't prevent the task force to complete their mandate. And then the last phase, which led to the release of the Action Plan for Pain in Canada, was really to provide some recommendations on priority actions for the future. let me tell you how much the minister actually fell off her chair when she actually saw the number of recommendations that was made in this report. So there were, I say more than 150, there's actually 162 recommendations that were made in this report. 6 overarching goal that spans from across a range of issues, including enable coordination, collaboration, improving access to timely, equitable, and person-centered care. Lots of recommendations related to research, pain surveillance, and then finally equitable approaches for population disproportionately impacted by pain. So that report was published in March of 2021. I came back in December 2021, and then I was asked, well, what are we doing about this? What's the next step? So first thing we did is, okay, well, let's look at what the evidence says in those reports. And this is basically kind of like a reflection about the impact of chronic pain in Canada. And you can see here, there's a lot of numbers, but you can also see kind of like some connections with some key priorities. Then that's the first step. Second step is okay, let's see what are the current social health priorities in this country. And you see that it's pretty closely aligned, right? You can actually see there's quite some alignment between the priorities that has been identified by the task force, some of the key issues that were reflected in those reports, but also some of the key priorities that has been illustrated in recent federal budget, mandate letters of ministerial mandate letters, and what's not. It's also a reflection about the shared responsibility federally about every single department, a number of departments that has a responsibility in taking action. Obviously, Health Canada plays a big role, but you have the public health agencies who are doing chronic disease surveillance and promotion and prevention. A number of departments that are actually addressing the health needs of specific populations, Veteran Affairs Canada, Department of National Defence, Indigenous Services Canada, Correctional Services Canada. You have the research granting agencies that has a responsibility over research and knowledge mobilization. Employment and Social Development Canada, leading everything that is related to policies surrounding disabilities, but they're also having a specific role around seniors. So it's kind of like when you take that, you kind of like see it's quite a lot of alignment. There's a number of federal departments that needs to be involved. So what do we do? So our response, or the federal response to task force recommendations, was really kind of like articulated around 3 distinct pillars. The first one is, let's not reinvent the wheel. Let's use our levers that we have and see how we can advance some of the priorities. Whether this is around expanding access for federal funding, or kind of like identifying some opportunities to embed pain considerations into our policies. The second piece is there's some great work, and I think that what the work of TPS is a great example. But how can we actually expand the knowledge and make sure that people are aware that about all this evidence, about all this great work that is currently going on? So how can we actually help mobilize that knowledge and create some synergies between different groups? And then finally, evidence, surveillance. How can we better get some pain data in this country? Because for many years, pain was not recognized as a chronic disease. So we were not tracking this issue. So how can we actually change that to make sure that we have the data that we need to make informed decision, but also to be able to better monitor our progress moving forward? And then finally, everything that we do must be informed by the people living with pain, and we need to ensure that we kind of like have some clear considerations as it relates to equity, diversity, and inclusion throughout. So that's basically kind of like the response. So I guess the question is, have we been successful? And this is kind of like just a very, very short snapshot of everything that has happened, perhaps over the past couple of years. So the first major initiative is the establishment of Pain Canada. How can we actually bring all the key players together? And that's kind of like, I think Pain Canada now has 14 different pain organizations and groups from across the country coming together into a single voice. significant progress made around guidelines. We just, last April, there was actually Solutions for Kids in Pain that actually released the first, the National Pediatric Pain Management Standard. This is actually the first in the world, and I think Canada needs to be proud of this. We supported the update to the 2017 McMaster guidelines surrounding opioid use for chronic pain management. And I know this is actually going to be presented next week at the National Pain Congress. So lots of tools that has been developed, Power Pain Portal, for instance. Number of initiatives surrounding pain education. I know AFMC have been quite engaged around kind of like revising their pain curriculum. And then lots of efforts to increase awareness. Through either the Canadian Pain Society Conference, the Putting Together the Pieces Conference, or during National Pain Awareness Week. Some progress on research. Chronic Pain Network was actually recently renewed for a second mandate with an additional $3.8 million investments, focusing specifically around knowledge mobilization and implementation science. Some more work around that is funded through SHRC as well. Around pain surveillance, there's been an increased number of pain questions now reflected in our national surveys. One that is probably not there is that we received confirmation recently that there will be a specific chronic pain questions in the upcoming Canadian Community Health Survey. So that's kind of like a big win for us, because I think that's going to be a big movement. And then surrounding equity and diversity, I think there's been a lot of efforts made around knowledge mobilization, with the creation of the Chronic Pain Center of Excellence for Canadian Veterans, for instance. Lots of work going on at correctional services and what's not. So I guess my big point is we need collaboration. It's kind of like, we often call this a top-down, bottom-up approach. Like, how can policymakers and researchers and the patients can actually work together into a cohesive way to make things happen. And I think this is kind of like what has been the success so far, is all the collaboration that we've done together to move things forward. Just to note some recent federal investments. So I think we're in the midst of a massive injection of new funding in the healthcare system, and I think there's an opportunity with that. Like, right? I think there's opportunities to continue working together and reflect that this needs to change. Canada Disability Benefit, I'm just going to note this one because there was a new investments that has been announced. Employment and Social Development Canada is actually conducting some consultations surrounding their regulations for this, and the details of that investment has not yet been announced. But I know there's, as part of those consultations, I know the pain community has been consulted on this, so this is something I wanted to reflect. So just to kind of like close the loop about kind of like, we need to continue to build the awareness around this issue. I don't think it's reflecting right now, and if you read the federal budget of last week, pain was mentioned once, but I think it's still not prominent in our policies. But how can we actually continue to bring the awareness? And I think National Pain Congress next week is actually going to be a great opportunity for this. There's also some work going on at the international level. I know ISP is actually planning to do a pain session at the upcoming World Health Assembly, and Canada has actually just confirmed its support. So that's going to be good. So thank you. I'm happy to respond to any questions, but I know we're close to break, right? So thank you.
With all those, I mean, different government entities involved, I think there's the collaboration from the medical side is there. I think it's the federal side that has to really invest in the collaboration and get that.
100%. 100%, and that's exactly what we're trying to do. Is kind of like, in our role, the role of our team is to make sure that this collaboration is actually going to take place. I can tell you at the National Pain Congress next week, we've confirmed participation of 9 different federal departments and agencies. So it's kind of like we are starting to see that momentum growing with our federal partners, but I agree, like there's still a lot of work to be done, and that's part of the awareness that we need to build, for sure.
What's the relationship with the provincial ministers?
So I think that the relationship is starting on the pain front, like it's slowly starting. Obviously, there's a lot of work right now surrounding the held bilateral agreements that I think has been signed with almost all provinces, if not all. Again, is pain going to be reflected as a specific priority as part of that? Probably not, but how can we actually kind of like get ourselves into kind of like the connections with all the other priorities that has been identified? So it's about not starting from scratch, but more how can we actually work together to make sure that pain is not forgotten as part of this work. So, yeah. Thank you.